And straight to our top story this evening on 5 Live. Amidst growing fears of the spread of the Omicron COVID variant, 10 foreigners, all with travel histories to South Africa and other African countries, have gone missing or are untraceable in Bengaluru at this point of time. There's a mild sense of alarm. The municipal corporation in Bengaluru is trying to trace them. The mobile phones of these international travelers are switched off. And remember, this comes a day after India's first 2 Omicron cases were traced in Bengaluru. Karnataka's Health Minister K. Sudhakar has told India today that after Omicron was detected in South Africa, 57 passengers have landed from that country in Bengaluru. He added 10 out of those 57 passengers are untraceable at this time. The Bengaluru civic body, the BBMP, does not currently know their whereabouts but is attempting to establish it. Minister Sudhakar said the health department is tracking them and they're not available at their mentioned addresses. As of now, 2 Omicron cases have been reported in Bengaluru, as first reported by India Today yesterday.
ಟ್ರೇಸಿಂಗ್ ಮಾಡ್ತಕ್ಕಂಥದ್ದು ಇದೊಂದು ಪ್ರಕ್ರಿಯೆ ಏನಿದೆ ಅದು ನಿರಂತರವಾಗಿ ನಡೆಯುತ್ತೆ. ಅದಕ್ಕೆ ಒಂದು ವೇಳೆ ಯಾರು ಫೋನ್ನಲ್ಲಿ ರೆಸ್ಪಾಂಡ್ ಮಾಡದೇ ಇದ್ದರೆ ಯಾವ ರೀತಿಯಲ್ಲಿ ಅವನು ಲೊಕೇಟ್ ಮಾಡಬೇಕು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಸ್ಟ್ಯಾಂಡರ್ಡ್ ಪ್ರೋಟೋಕಾಲ್ ಇದೆ, ಆ ಪ್ರಕಾರ ಕ್ರಮ.
ಸಿಗದೇ ಇರೋದು ನಿಜನಾ ಸರ್? ಹಾಗಾದ್ರೆ 10 ಜನ ಟ್ರೇಸ್ ಔಟ್ ಆಗ್ತಾ ಇಲ್ಲ.
ಅದರ ಬಗ್ಗೆ ಏನು ಪ್ರತಿಕ್ರಿಯೆ ನೀಡಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ. ನೇರ ಮಾಹಿತಿ ನನ್ನ ಹತ್ರ ಇಲ್ಲ. ನಾನು ಇಷ್ಟೇ ಹೇಳ್ತೀನಿ, ಯಾವುದೇ ಒಂದು ಪರಿಸ್ಥಿತಿನಲ್ಲಿ ನಾವು ಅದಕ್ಕೆ ಸಿದ್ಧತೆಯನ್ನು ಮಾಡ್ಕೊಳ್ತೀವಿ. ನಾನು ಜನರಲ್ಲಿ ಏನು ಸಹಕಾರ ಕೇಳ್ಕೊಳ್ತಾ ಇದ್ದೀನಿ ಅಂದರೆ, ನೀವು ನಿಮ್ಮಲ್ಲಿ ಒಂದು ಸೇಫ್ಟಿಯನ್ನು ಇಟ್ಕೊಳ್ಬೇಕು.
Now, the alarm over this new COVID variant, Omicron, has finally reached India. 2 new cases have been detected in Karnataka. Yesterday, like I said, all necessary steps are being taken by the state, and primary and secondary contacts of both those individuals have been traced and are being tested. The Karnataka Chief Minister has held a key meeting amidst this Omicron scare. Here's everything you need to know, especially if you live in Karnataka.
What was feared is now a reality. The Omicron variant that has the world on its toes has made its way to India. The Union Health Ministry on Thursday confirmed 2 cases have been detected in Karnataka.
24 घंटे के अंदर हमारे देश में 2 ओमिक्रॉन वेरिएंट के केस हमारे इस नेटवर्क के द्वारा डिटेक्ट किए गए कर्नाटका में. जैसे कि हमारा प्रोटोकॉल है, ना कि हमारे इंसाकॉग नेटवर्क ने उसको समय पर डिटेक्ट किया, बल्कि एज ए प्रोटोकॉल, एज ए प्रैक्टिस जो हमारी कॉन्टैक्ट ट्रेसिंग की पद्धति भी शुरू हुई है, और जितने उनके प्राइमरी कॉन्टैक्ट हैं और जितने सेकेंडरी कॉन्टैक्ट हैं उन सबको ट्रेस कर लिया गया है.
One of them is a 66-year-old fully vaccinated man who has a travel history to South Africa. And the second patient is a 46-year-old man who is an Indian national and a health worker with no travel history. The Bengaluru civic body says the patient has left India for UAE on November 27th.
That person who has left to South Africa via Dubai has presented a certificate from a private lab showing that he is negative. And when we have tested his primary and secondary contact, none of them has been positive.
India Today has learnt that both the cases are unrelated. The source of health workers' infection remains unknown. The Karnataka government is taking no chances.
We are very alarmed and cautious. Our duty is now to see that not only these 2 persons, otherwise also to track and trace such strains wherever it is found and their contacts. We are already doing the tracking and tracing of international travelers.
Since very little is known about the virus, health experts have advised caution and made it clear that it's not the time to lower guard.
There are not factor possibly is between 12 and 18 and even maybe more. That means for every person who gets infected, they could infect upwards of 12 to 18 people. That means the way it will spread is so rapid that many people will get infected. And the numbers seem to be doubling almost every day.
Right.
That is the worrisome part about its infectivity.
I think it is a lockdown sort of situation. Means imagine that it is a personal lockdown for at least next 2 weeks. Next 2 weeks are going to be very important and very vital. If we consider the reports which are coming from South Africa, till now younger people has been affected.
With 2 confirmed cases of Omicron in India and more cases likely to crop up in coming days, it is as much up to the citizens as the government to ensure there is no repeat of the horror we witnessed during the second wave. With Milan Sharma, Bureau Report, India Today.
And here's what Health Minister Mansukh Mandavia said today in Parliament. He provided a lengthy, very, very detailed sense of India's preparations and battle plan for the Omicron variant. Take a look.
WHO ने सार्वजनिक किए आंकड़ों के मुताबिक कोरोना के 26 करोड़ से ज़्यादा केस दुनिया भर में रजिस्टर हुए हैं और 52 लाख से ज़्यादा लोगों ने अपनी जान गंवाया है, जो 1.99% मृत्यु दर को दर्शाता है। भारत में भी 3.46 करोड़ कोरोना के केस आए हैं और 4.69 लाख लोगों का निधन हुआ है, जो कुल मामलों का 1.36% है। भारत में पर मिलियन आबादी पर करीब 25,000 कोविड के केस और 340 मृत्यु दर देश में दर्ज हुई है, जो कि दुनिया में सबसे कम रेट में से एक है। पीएम केयर, प्रधानमंत्री जी ने क्या गुनाह कर दिया माननीय अध्यक्ष महोदय। उन्होंने देश में 75,000 वेंटिलेटर की आपूर्ति करने के लिए 58,000 वेंटिलेटर खरीदने के लिए ऑर्डर दिया, देश के लिए, सभी राज्यों के लिए, वो कोई स्टेट में। और दूसरा माननीय अध्यक्ष महोदय, सभी स्टेट के पास आज स्टेट सेंट्रल सब्जेक्ट होने से मेन पावर किसके पास है, हॉस्पिटल किसके पास है, स्टेट के पास ही है। हमें देना है तो स्टेट को ही देना है, स्टेट को ही जरूरियात पूरी करनी है। स्टेट को जरूरियात पूरी करने के लिए वेंटिलेटर सप्लाई किया और ये सर्टिफिकेट आपकी स्टेट के ऑफिसर ने और आपकी स्टेट की गवर्नमेंट ने आज तक 42,000 सर्टिफिकेट, वहां से सर्टिफिकेट में क्या लिखा है, उसको इंस्टॉल हो गया है, इंस्टॉल होने के बाद अच्छी तरह से चल रहा है। जरूरियात न हो और इंस्टॉल उसका यूज न हो एक बात है, अच्छी तरह से हो गया हो और ये हो जाने के बाद वहां के लोगों को ट्रेनिंग दी गई है। ये ट्रेनिंग के बाद राज्य सरकार ने दिए हुए सर्टिफिकेट है 42,000 सर्टिफिकेट। सम्मानित सदस्य श्री, आपकी स्टेट ने ब्रेकअप में सारा एग्जाम्पल लेके आया हूं और आप चाहे तो उसको उपलब्ध भी करा देंगे। जब हम बिना आधार से बात तो कर सकते हैं माननीय अध्यक्ष महोदय, पॉलिटिक्स तो हम कर सकते हैं, लेकिन सत्य तो सत्य ही रहता है।
And I'm going to show you now what preparations are in force right now as far as the Omicron variant is concerned. I apologize for what we just showed you. That was Mansukh Mandavia, the health minister. But what he's basically done was basically answer some questions regarding what India's preparations are really looking like. Well, according to the Karnataka health minister, 2 people have been found positive for the Omicron variant of COVID-19 in Bengaluru. In Maharashtra, the count of Omicron suspects at this time has gone up to 28, including 10 from the city of Mumbai itself. According to sources in Delhi, 12 patients are currently suspected to be infected with the Omicron variant, but it's not confirmed. All of them have been admitted to the dedicated LNJP hospital in the city. In Rajasthan's Jaipur, 9 persons across 2 families have been tested so far as positive. What is worrying is that 4 of these family members have recently returned from South Africa, so it's quite likely that they may have the Omicron variant. In UP's Lucknow, 2 women have been found infected. Both the women recently returned from Kerala. They're suspected to have the Omicron variant. In Chennai, 2 international passengers, including a child who had arrived from Singapore and the United Kingdom, have tested positive for COVID. They are also suspected to have the Omicron variant. And 1 suspected case of Omicron has also been found in Hyderabad. So as you can see, 2 confirmed cases in Karnataka, but the number of suspected cases is quite large. And so the confirmed number of Omicron cases is likely to shoot up in just the next few days. Here's a list of the commonest questions that you and I are probably asking each other on our WhatsApp groups, in our neighbor groups, and hoping for some kind of clear precise information. Does Omicron illness involve emergency oxygen requirements? The health minister answered one of those questions in his answer in Parliament. But let's tell you a little bit more. None of the Omicron cases so far have required oxygen support. This doesn't mean that may not change, but as of now, the good news is none of the active Omicron cases have required emergency oxygen support. Do I need to worry about stocking oxygen like I did during the second wave? Well, the government says all the oxygen shortage lessons during the bitter experience of the second wave have all been learnt and it won't be repeated. There is more than enough preparation as far as oxygen is concerned, so you won't have to go through that. Number 3, could Omicron, the current infections grow into a second wave-like disaster? Because nobody's forgotten that experience. It's possible theoretically in terms of numbers, but unlikely anywhere near that kind of scale in terms of fatalities, the way it is looking right now. I want to add a caveat and a disclaimer in everything that we tell you right now, because things could change with this virus. That's the one thing it has taught us. By when will the true nature of the Omicron variant become clear? Well, studies that are on right now, both in India and abroad, will make the picture clear in the coming 2 weeks maximum. We'll have a clear picture about Omicron. Do I need to worry about medicine availability? The government says medicine shortage lessons that were learned bitterly during the second wave will not be repeated this time. Supply chains have been smoothened out in a very big way. Do you need to worry about hospital bed availability? All of us remember how there was this anxiety about whether you or I would need a hospital bed if it actually came down to that. Right now, we can tell you there's no need to worry, because worst case scenarios and preparations are being war-gamed by the government, and those are currently in force. So don't worry at this point of time. The government says don't panic, but you're already panicking a little. Everybody is. Everybody remembers what happened in the second wave when preparations were woefully inadequate. It's natural to panic, and that's why I would urge you to continue to watch India Today, because we will, I promise you, have the clearest and most up-to-date information on what you can expect, what you can do, and what you needn't actually panic about, which is very, very important. We've got some breaking news coming in now. Okay, breaking news coming in from Karnataka. The government has introduced fresh curbs in the state of Karnataka after 2 Omicron cases were detected yesterday. Only 500 people will be allowed at any public gathering. I mean, that's still a pretty large number, but 500 people is the limit for all public gatherings, including wedding functions. Entry into malls and theatres only for fully vaccinated individuals. All cultural activities at schools and colleges stand postponed till January of next year, till next month, that is. Parents of school kids must be fully vaccinated. So a 2-page advisory with fresh guidelines has been issued. No major changes. All of these have already basically been in effect. Persons above 65 will require to be tested as well. But basically the changes are that the cap on public gatherings stands at 500 people. That's a large number. Doesn't really affect the way things have been carrying on for the last few weeks and months.
The culture activities, fest functions in all education institutes should be postponed till 15th January 2022. Compulsory testing of health workers, old person above 65 years and persons with comorbidity will be undertaken by the government. The entry to mall, cinema theatre shall be allowed only the person who have vaccinated with 2 doses of COVID vaccine 19.
Will the Omicron variant wreak the same havoc as the Delta variant did during the second wave? The government says it is armed for a worst-case scenario and that the Indian population has already been exposed to the Delta variant and has significant immunity to fight. So it says, don't panic. We are prepared for any worst-case scenario. Here's all you need to know.
The Omicron variant of coronavirus is in India. But do not panic. The government is armed for a worst-case scenario. That's the double-barreled message to citizens from the government. You're wondering why the government advises against panic this time? There are reasons. First, the government says the Indian population has been exposed to the deadly Delta variant of coronavirus and has significant immunity. The health ministry has been specific on this count, saying that given the fast pace of vaccination in India and high exposure to Delta variant, as evidenced by high seropositivity, the severity of the disease is anticipated to be low. The Indian Council of Medical Research's last sero survey done to assess the level of antibodies in the Indian population says that 67% of India's population above the age of 6 has been exposed to COVID-19. The Indian Council of Medical Research surveyed 36,227 people across 21 states in June and July this year and found that 2 out of 3 has antibodies. But while there's cautious optimism on India's ability to perhaps handle Omicron better, the government is clear that scientific evidence is still evolving. Experts agree, but the permanent disclaimer when dealing with COVID that caution can never leave the building.
A large number of people who are living in India have been vaccinated, and some others have been naturally infected, and a significant overlap has occurred between the two, which means that some people who've been naturally infected have also received vaccination, which leads to something called hybrid immunity. So if new variants spread in India, it will be mostly the unvaccinated people who are at greater risk.
We need not worry much about this Omicron right now. The reason is this virus is mild, as such the data shows. Second, we need to get a lot of information more about this Omicron, about the disease severity, as well as the drug efficacies and all.
India is also deriving solace from the fact that unlike the beginning of this year when the second wave of COVID had gripped the country and India's pace of vaccinations was rather sluggish, the situation is different now. The pace now has picked up.
घर घर दस्तक एक टीकाकरण अभियान देश में स्टेट के साथ मिलकर शुरू किया। इसी एफर्ट्स के चलते हमने देखा है कि पिछले एक माह में देश में फर्स्ट डोज का कवरेज करीब 5.9% के करीब बढ़ा है।
While uncertainty around Omicron continues on many fronts, the government says they are taking no chances and gearing up for the worst, given Omicron has 2 times the number of spike mutations than the Delta variant that continues to be the most dominant variant in the world. In New Delhi, Sneha Mordani for India Today.